All right, in this video, we are going to discuss therapy with intestinal carbidopa-levodopa, what is known commercially in the United States as Duopa, and in Europe, it is known as Duodopa. And let me explain you exactly what this therapy is. So, in first place, this is a therapy for people with more advanced Parkinson's disease, and the ideal candidate for Duopa is a patient that is suffering from frequent motor fluctuations. Now we're looking for people that are having at least 3 hours in the off state per day. And it's not 3 hours all at one time. We're talking about 3 hours where they might be in the off state 45 minutes now, 1 hour later, 15 minutes later. So if you add up all that time and you're reaching 3 hours or more, then you will be considered what will be a good candidate for therapy with intestinal carbidopa-levodopa. And typically what your doctor is going to do is he is going to adjust your medicines. He will be increasing your carbidopa-levodopa. Your doctor will be increasing the other medications that you're taking, dopamine agonists. They might be taking your entacapone or picapone, or they might use other medications such as amantadine. So your doctor will be using a combination because always the main goal is try to avoid the surgical procedure, right? But if after doing all those adjustments, you continue having motor fluctuations that are bothering you on a daily basis, then this therapy may be an option for you. In another video, we spoke already about deep brain stimulation surgery. We spoke about the device. There's going to be another video that will talk about who is the right candidate for DBS. However, in this one, we're touching on the intestinal carbidopa-levodopa. Let me show you how the device is and explain this to you in detail. So in first place, this is the part that is the most dreaded by people because this is an infusion therapy. So typically what is going to happen is that a doctor with experience putting these devices is going to put a small tube, and I call this the medication infusion port, right? This is the tube by you will be receiving the medicine, and the tube has an extension inside the stomach, and the tube will go just right in the epigastric area, the stomach area, okay? And there will be an extension that goes all the way to the small intestine, and the tip will be right in the area of the small intestine where the levodopa is absorbed. And the goal of this is that it will bypass any issues with gastroparesis. It will bypass any absorption issues that you might have with the carbidopa-levodopa. So you will have a steadier and more reliable infusion of the medication. So that will be the part that is the most difficult. So you will need to have a surgeon put this. We have great surgeons in the Orlando area that are very experienced putting this particular device in place. And then after that, what is going to happen is that once the PEG-J, that's how we call it, or the medication infusion port is in, you come back so that we can connect you to the pump. Now, before I move on to the pump part, I want to clarify that while this looks like a feeding tube for some people, you still eat and drink and you use your mouth for everything that you use it. However, the goal is going to be to control your Parkinson's disease with the medicine that you get using the pump. So right here you have the pump itself. This is how it looks like, okay? And what you are going to do is you will be receiving these cassettes, okay? So the cassette, let me go ahead and get this a little bit closer. The cassette will be filled with the medication, with carbidopa-levodopa, right? And you will be connecting it to the pump, and the pump, which is right here, will be pre-programmed by your doctor. We are going to assess what is going to be that initial dose of the medication, plus what we call the continuous rate, which is the amount of medication that you will be having infused for the rest of the day. So the typical history of a patient that is using this kind of therapy is this. They wake up in the morning, they go to the fridge, and they will take out the cassette. They're going to put it on the table for about 20 minutes, all right? After 20 minutes, they will proceed to get the cassette. They will connect it to the pump. And the way that the pump is connected with the cassette is like this. And then you use something that will keep the cassette in place. So, I'm trying to use here. We go ahead. Oh, I was turning to the other side. So right here we have the cassette now connected to the pump, okay? And you will connect now the tip of the cassette with the tip of the small peg J that you have in place, right? And after that, you turn the pump on, you administer what we call the morning dose, and that's it. The pump is going to give you what we call a loading dose of the medication. That's how we call it in my clinic. And after that, you will be getting a small amount of the medications, actually almost every minute, right? It's just a small dose. You will be able to hear the pump slightly giving you the infusion of the medication. The goal of this is to bring the levodopa levels in the brain higher, and then by giving you a small infusion during the day, you will be able to maintain a steady level of the medication. And by doing so, we're going to minimize. And remember that the important thing is that this medication is delivered to the part of the small intestine where the drug is going to be absorbed. And by doing so, we're going to minimize any issues with absorption, whether your stomach is moving properly or just about any other issue, any interaction or food, or just about anything else. So I find this to be a good therapy for certain group of patients. Obviously, the idea is for you to have the proper evaluation with your movement disorder specialist. They are going to assess whether this might be the right therapy, right? The most common question is Duopa versus deep brain stimulation surgery. So we as doctors, we have the experience. We will be able to tell you what we think is going to be the best therapy for you. The other good thing about Duopa is that this is a potentially reversible therapy. So typically, if you have it in place, we can try how well you're responding to the therapy. We will need some time to find what is going to be the right dose for you. So this is a customized therapy, right? Not everybody gets the same dose. Every person with Parkinson's disease gets a different dose of the medicine. So what is going to happen is that we will adjust and program the pump for you. You will take it home. You're going to be using it for a few days. You're going to give us some feedback, and we are going to continue adjusting the medicine based on your feedback for you to have the best benefit. The pump gives you kind of a rescue button as well in case that you're not doing well and you feel you need a little bit more of medicine than usual. You just give yourself what we call an extra dose, and it is intended to give you that small boost of the medicine to make you feel better. So I really hope that you find this video to be helpful. You know, the goal of this is to educate you. Obviously, you need to go back to your neurologist or movement disorder specialist to talk about the details about these therapies. The one piece of advice I can give you, and this is something that I learned from other patients, is that initially when we talk about these therapies, having a tube in the stomach, popping out, and so on, it can be a little bit daunting and scary, right? But you know what? I think that when patients eventually go through these therapies, because for one reason or another, it's what they chose or they have no other reasonable option for them. Typically, when they come back, they typically come back satisfied. They're getting more benefit or they are improved compared when they are taking the medications by mouth. And obviously, the main goal is that once you are on the pump, at least in my clinic, is to get you to what we call monotherapy, which is just one medicine to treat your symptoms of Parkinson's disease. So I really hope that you find this video to be helpful. If you have any questions, please do not hesitate to contact us at learnaboutparkinson.com, or you can connect with our clinic at info@neurology1.net.